prepared by Professor El-Tanani. Many people look at body fat only as a cosmetic problem. They ask, how can I lose weight? How can I reduce my belly? How can I look better? But today I want to explain something more important. Not all fat in the body is the same. Some fat is useful, some fat is less harmful, and some fat is metabolically dangerous. The most important fat we need to understand is called visceral fat. This is the deep fat stored inside the abdomen, around organs such as the liver, intestines, and pancreas. Visceral fat is not just sitting there quietly. It is active. It can affect hormones, inflammation, insulin resistance, blood sugar, blood vessels, and long-term health. And importantly, excess body fat and obesity are linked to increased risk of several cancers. This does not mean that every person with belly fat will get cancer. And it does not mean that thin people are always safe. But it does mean that reducing harmful fat, especially visceral fat, can be an important part of cancer prevention and overall health. In this video, we will explain what is good fat, what is bad fat, what is visceral fat, why can visceral fat be dangerous even in a slim person, how can excess fat increase cancer risk, and most importantly, what can busy, ordinary people do in a simple and realistic way? The goal is not perfection. The goal is to start. Even a few minutes can matter when done correctly. Let us begin. Thus, not all body fat is the same. There are different types. Subcutaneous fat is the layer just under the skin that you can pinch. Visceral fat is different. It's the fat deep inside your abdomen surrounding your internal organs. This type is more strongly linked to health risks like insulin resistance and inflammation. There's also ectopic fat, which is fat stored in places it shouldn't be, like the liver or muscles. A person can even look slim, but still have high visceral fat. When people hear the word fat, they often think they must avoid all fatty foods, but this is not correct. Some dietary fats are healthier than others. Good fats, found in foods like olive oil, nuts, seeds, and fatty fish, can support heart health when used in moderation. On the other hand, we should limit less healthy fats. Trans fats, found in some processed and fried fast foods, are harmful to cardiovascular health. We should also limit excessive saturated fat from processed meats and ultra-processed foods. Visceral fat is dangerous because it behaves like an active organ. It can release inflammatory chemicals, worsen insulin resistance, affect hormones, and contribute to fatty liver, changing the metabolic environment inside the body. These changes are linked to a higher risk of conditions like type 2 diabetes, heart disease, and certain cancers. Visceral fat is especially important because it can exist even when a person does not look overweight. That's why a normal weight is not always enough. So don't just ask, what is my weight? Also ask, what is my waist size? How is my blood sugar? And how fit am I? Excess fat is linked to cancer through 4 major pathways. First, inflammation. Visceral fat can promote chronic inflammation, creating a harmful environment that may support cancer development. Second, insulin resistance. This leads to high insulin levels, which can act as a growth signal, encouraging cells to divide more. Third, hormones. After menopause, fat tissue can produce estrogen, and higher levels are linked to breast and endometrial cancer. Fourth, metabolic dysfunction. Excess visceral fat often accompanies fatty liver, creating an internal chemistry that can affect the whole body. While scans are the most accurate way to measure visceral fat, you don't need one to get started. There are simpler clues. A key clue is your waist size. As a general rule, try to keep your waist measurement less than half your height. Other warning signs include certain blood markers, high blood pressure, and fatty liver, which is often linked to visceral fat. Low fitness is another indicator. If you get tired easily with simple activities, your risk may be higher. Many people say, "I know exercise is good, but I have no time." This is real life, so let's be practical. If you have only a few minutes, the best approach is to combine short resistance exercise and brisk movement. Resistance exercise is very important because it builds muscle, which is a metabolic organ. More active muscle helps the body use glucose better and improves insulin sensitivity. For a busy person, a few minutes of resistance exercise can give a strong metabolic signal. The best plan is to combine it with walking. But if you can only choose one, choose something you will actually do. Here is a simple 5-minute resistance plan for busy people. No gym or equipment needed. First, a safety note. If you have any medical conditions, please ask your doctor before starting. The plan has 5 movements. Do each for 40 seconds, followed by 20 seconds of rest. The exercises are chair squats, wall push-ups, standing march, hip hinges, and a plank on a wall or table. That is 1 round. If you have more time, do 2 rounds. On other days, walk. The goal is to send a consistent message to your muscles. If 5 minutes feels too little, here is a 10-minute plan. 2 minutes warm-up, march in place or brisk walking. Then do squats for 45 seconds, rest 15 seconds. Wall push-ups for 45 seconds, rest 15 seconds. March fast for 45 seconds, rest 15 seconds. Hip hinge for 45 seconds, rest 15 seconds. Plank on wall for 45 seconds, rest 15 seconds. Repeat once. End with 1 minute of slow walking and breathing. This is still only 10 minutes, but if done consistently, it can improve strength, fitness, and metabolic health. Remember, consistency beats intensity. A simple plan done 5 days a week is better than a perfect plan done once a month. Now let us be fair to walking. Walking is one of the safest and most accessible exercises. It improves heart health, it improves mood, it helps blood sugar, it helps digestion, it reduces sitting time. It is excellent for long-term health. The American Cancer Society recommends adults get 150 to 300 minutes of moderate intensity physical activity per week, or 75 to 150 minutes of vigorous activity. WHO guidelines also recommend at least 150 to 300 minutes of moderate aerobic activity per week, or 75 to 150 minutes of vigorous activity, plus muscle strengthening activity on 2 or more days per week. But many people cannot start with that, so start small. A 10-minute walk after meals can help blood sugar. A brisk 20-minute walk can help fitness. Walking during phone calls can reduce sitting time. Parking farther away helps. Taking stairs helps. Standing every 30 to 60 minutes helps. Walking is still good. But if visceral fat is the main problem and time is limited, add resistance exercise. Because muscle is your metabolic engine. For busy people, keep it simple. Here are 5 practical food steps. 1. Stop drinking calories from sugary drinks and sweetened juices. 2. Build every meal around protein and add vegetables or salad to help you feel full. 3. Choose smarter carbohydrates by reducing white bread and sweets, and including whole grains. 4. Use good fats like olive oil and nuts, but control portions as they are calorie-dense. 5. Avoid frequent ultra-processed foods like fast food and processed snacks, making them occasional, not daily. Visceral fat is not only about food and exercise. Sleep matters. Poor sleep can increase hunger, cravings, stress hormones, insulin resistance, and weight gain. Try to protect sleep as much as possible. Stress also matters. Stress alone is not the only cause of visceral fat, but chronic stress can lead to overeating, poor sleep, low activity, and unhealthy choices. Sitting is another major issue. Even if you exercise, sitting all day is not ideal. Break sitting time. Stand up. Walk for 2 minutes. Stretch. Take phone calls standing. Use stairs. The body was designed to move, not necessarily to exercise for hours, but to move often. This is very important. Some people say, "My weight is normal, so I am fine." Not always. A slim person can still have visceral fat. This may happen if the person has low muscle mass, poor diet, high sugar intake, little physical activity, poor sleep, stress, fatty liver, or genetic tendency to store fat around organs. This is why waist size and metabolic markers matter. A slim person with high visceral fat may still have insulin resistance, fatty liver, high triglycerides, or prediabetes. So the goal is not just weight loss. The goal is body recomposition. That means less visceral fat, more or preserved muscle, better insulin sensitivity, better fitness, better waist size, better metabolic health. For slim people, extreme dieting is not the answer. They may need more protein, resistance exercise, less sugar, better sleep, and more daily movement. Here is a realistic weekly plan. Monday, 5 to 10 minutes resistance exercise. Tuesday, 20 minutes brisk walking or 10 minutes after 2 meals. Wednesday, 5 to 10 minutes resistance exercise. Thursday, brisk walking or stairs. Friday, 5 to 10 minutes resistance exercise. Saturday, longer walk if possible. Sunday, rest or gentle walk. If you cannot do 20 minutes, do 10. If you cannot do 10, do 5. If you cannot do exercise clothes, do chair squats and wall push-ups in your office. If you cannot go to the gym, use your body weight. If you cannot walk outside, walk indoors. If you cannot do vigorous exercise, do gentle exercise. The worst option is doing nothing because you cannot do everything. Something is always better than nothing. People often want fast results, but visceral fat reduction needs consistency. You may notice waist becoming smaller, better energy, better blood sugar, lower triglycerides, improved blood pressure, better sleep, better fitness, less breathlessness with stairs, better strength. The scale may not change quickly if you are gaining muscle and losing fat, so measure progress in more than one way. Use waist size, body weight, how clothes fit, fitness, strength, blood sugar, triglycerides, blood pressure, fatty liver improvement if your doctor is monitoring it. Do not chase perfection, chase progress. Let us conclude. Fat isn't always bad. The body needs some. Good dietary fats in the right amount are part of a healthy diet, but excess visceral fat, the deep abdominal fat around your organs, is different. It is metabolically active. It can worsen insulin resistance, inflammation, hormones, and fatty liver, increasing long-term disease risk. Excess body weight is linked with increased risk of several cancers, and these harmful metabolic changes are part of the explanation. But the good news is this: visceral fat responds well to lifestyle changes. You do not need a perfect plan. You need a realistic one. Eat more whole foods, prioritize protein and vegetables, and reduce sugar. Control portions, even with healthy fats. Walk when you can, break sitting time, and sleep better. Most importantly, add short resistance exercise. If walking is all you can do, walk. But for a stronger effect in less time, combine walking with resistance exercise to build muscle and improve metabolic health. Start with 5 minutes today. This video is for general health education only. It does not replace medical advice, diagnosis, or prescription from a qualified healthcare professional. If you have a medical condition like heart disease, uncontrolled blood pressure, or diabetes, please discuss exercise and weight loss plans with your doctor. With subtitle and consistent styling,